Hi, everyone, and welcome. I'm Susan Demas, the executive editor here at Lincoln Square. And joining me today are two physicians who are on the front lines, and they can talk to us about what's at stake right now with healthcare after Republicans passed their budget over the summer, and now they have shut down the government. Dr. Christopher Ford is a Wisconsin based emergency room physician. He's a member of the Committee to Protect Healthcare, and he has been a leading voice on the impacts of policy changes with the Affordable Care Act. And he has most recently partnered with Senator Chris Murphy to bring national awareness of that. Dr. Farhan Bhatti is from Michigan, actually right here in Lansing where I am, and he is the Michigan state lead for the Committee to Protect Healthcare. His clinic is Carefree Medical. It provides high quality healthcare to the underinsured and uninsured adults and children from across the region in the Lansing area. So, doctors, thank you both for being here at this time.
Thank you, Susan.
I wanted to start with the federal government shutdown, which is now about a week old. And healthcare has been at the forefront of what Democrats in Congress have been fighting for. And they have said that they want to have a vote to make sure that the subsidies for Obamacare, for the Affordable Care Act, do not expire at the end of the year, because millions of people depend on that so that they can have, more affordable health care. Dr. Ford, I'll start with you. Can you talk with us about what the situation is for people and for healthcare, and what we're looking at in terms of affordability going into the next year?
Yeah, so I think a lot of what we're seeing now is people being affected who can ill afford it to affect them as much as it will. In 2021, like you mentioned, Susan, under the American Rescue Plan, we saw an increase in that ACA tax credit and that expanding of eligibility for households with annual incomes of over 400% of the federal poverty limit. So we're talking about people who are needing it the most in that setting. With these cuts that we're expected to see, we're expecting over 24 million Americans to lose that healthcare coverage, and we're expecting their premiums in that marketplace to go up exponentially. And again, these are families that can ill afford it. What we usually will see in those cases, when we have about 75% of those people who registered lose that healthcare insurance, we're going to see folks who are not only going to have to primarily receive their care through the emergency department, but we will also be seeing folks who just will avoid going to the emergency department in general, go to the doctor in general. They're going to not have access to their medications. They're not going to have access to procedures, to imaging, things of those natures that will prevent them from being in the emergency department. So this is going to be an issue that we're going to see hit hardest in the emergency department and throughout all communities.
And Dr. Bhatti, what are you hearing from in terms of your patients in Michigan and concerns that people have about losing access to their health care?
Well, my patients are scared. The vulnerable patients that Dr. Ford talked about, those are my patients. Those are the people that we see every day. And these are people who are working. They're doing their best to support themselves and their families. Their employer doesn't offer health insurance, so they've got to go on the exchange and buy for themselves. And, they can't afford a 114% increase in their premiums. They can't afford to have 30, 40, 50% of their monthly expenditures be healthcare. They've got other bills to pay. They've got to support themselves and their children and their loved ones. And so my main priority is advocating on behalf of my patients and making sure that they can keep their health insurance, because they're going to get priced out of it if the tax credits aren't renewed. A lot of them are just going to opt to go without because they won't be able to afford it anymore.
And how many people currently receive their health care on the ACA Health Exchange?
Yeah, so we see over 24 million individuals that get their health coverage through federal and state marketplaces, right? And so those are going to be the folks who we're going to see, be at highest risk. So again, we're going to see these premiums rise for about 75% of those individuals. And in rural areas, I'm fortunate enough to practice pretty much in every area in Wisconsin now. This increase in rural areas could be as much as 90%, right? So it's 90% of these populations, a lot of whom have representatives who are voting against their interests in these cases that are going to be affected, and again, that are going to be at risk of losing that coverage.
And earlier this summer, when we were debating, when Congress was debating the budget bill, there was a lot of focus on folks who get their health care via Medicaid and that they would be losing their coverage. Probably not quite as much focus on folks who get their coverage through the actual healthcare exchange for the ACA. But obviously everything's connected. In addition to that, I know that we've already started to see some rural hospitals across the country close or announce future closures. And so it seems to me that the overall healthcare system is under tremendous strain right now. And I was wondering, Dr. Bhatti, can you talk with us about that and what we will be looking at over the next couple of years?
So that's very true in the overwhelming majority of the states. And we'll talk about Michigan momentarily, but rural America in general is under attack. We're going to create these healthcare deserts where there's no hospitals within an hour radius, and people are going to have to drive long ways to get the care that they need. And it's just really sad that healthcare has become such a partisan issue. Like, the politics should really have nothing to do with the health and well-being of my patients and whether or not they live or die, because really these medications that they're getting are life-saving, and if they have to go without insurance because they can't afford it and they make too much to qualify for Medicaid, they're not going to be able to have a good quality of life. They're going to have bad outcomes. We are fortunate here in Michigan that the budget that was just passed included full funding for Medicaid. So it basically counteracted all of the cuts that came from the federal level. We met that in Michigan. We met that challenge, and our legislature stepped up in a bipartisan way to secure Medicaid funding at current levels. But that still doesn't help these folks that we're talking about here today, the people whose tax credits are going to expire at the end of the year if nothing's done, and that are going to have really bad outcomes.
And of course, a lot of states won't be backfilling the amount of money that they, were getting from the federal government, which, is in many cases millions upon millions of dollars. And with a lot of states facing overall cuts coming down the line from the federal government in a lot of areas, that seems to me that it will be increasingly difficult, in future budget cycles for states to do what Michigan just did. And Dr. Ford, if you could talk with us a little bit, because I know you were saying that you are practicing in a lot of and see a lot of rural patients. And Dr. Bhatti was talking about how, really rural America is under attack. What does it mean if patients have to drive, 50 miles away, to seek emergency care if they're in the midst of having a heart attack or a stroke? What will that mean for outcomes?
To be honest with you, it's the difference between life and death in a lot of situations, right? Just because some of these rural locations close doesn't mean that those problems go away in that area, doesn't mean that the patients get any healthier. What's going to be the reality is, especially here in the state of Wisconsin, where, like your body was speaking to, you're the only provider in 40 miles and it may be an hour to get to the next location. You're going to have these people who are very sick. You're going to have folks who are having precipitous labor, right? Or complications of labor. You're going to have folks that are going to have to travel to the nearest ER. And in a lot of cases, those are in the urban centers, which are already facing, bed shortages. We're having extremely high wait times. All hands are on deck in those cases, right? And so you're going to not only have to wait, by that physical delay in geography, but you're also going to have to, the emergency departments that are going to be pressured and essentially backed up from already, the constraints that are present in our healthcare systems.
You mentioned that people may not be able to receive labor and delivery care. I know that that's also been an increasing problem, especially since the Dobbs decision came down from the Supreme Court in 2022, that in many rural areas, they've actually been losing OBGYNs, and some of their departments have just been closing in the hospitals. Do you see that that will continue to accelerate in future years?
Certainly, what the data very clearly shows is that not only are these hospital closures bad for our patients, they're also bad for the economy. And when these hospitals oftentimes are the biggest employer in the region, when they shut down, that talent leaves. And when the talent leaves, it never comes back. It's so hard to recruit people to come to rural Wisconsin, rural Michigan to set up and live and work. And when you take their jobs away because the hospital closes, they're going to go find work somewhere else. So it not only hurts our patients, it also hurts our bottom line here across the country. Everywhere that this happens, it's bad for the economy as well.
Mm-hmm.
And Dr. Bhatti, I know that we have been facing a situation where for years we have been talking about the fact that we still have millions of people who are uninsured in spite of the ground that has been gained with the Affordable Care Act. But there was a robust policy debate about that we need to get to a point of universal coverage. Perhaps we need a single payer system. And that dominated a lot of politics, particularly in the Democratic Party. Now we're at a point where we're going backwards, where millions of people are at risk for losing their health care next year and will. How did we get to this point instead of making progress, however gradual, that now we're going to be so drastically backsliding?
The answer to that question is very simple. Elections have consequences. And that's how we got here. We've got people in leadership right now who, even though I can't understand why, they don't really have that empathy. They don't really have a priority to provide healthcare to their citizenry. And when they talk about having things like tax credits expire, they don't talk about any alternatives. They don't talk about what are we going to do to help these people who are about to be priced out of having health insurance. It's like just not a priority, and it needs to be. It needs to be the most talked about issue in the upcoming election, because if we continue to put people in positions of power that don't care about the health and well-being of our patients, this is what's going to happen. We're just going to keep going backwards.
And to that point, Susan, to piggyback off of Dr. Bhatti, what we are seeing right now are the folks who can least afford this, right? These effects are going to have the biggest effect on them in the long run. I have patients that I've seen in my emergency department that have this coverage right now, right? Have Badger Care, which is our form of Medicaid here in the state of Wisconsin, but still have to pick and choose because we don't have that federal match here in Wisconsin as to which medications they need to use for their COPD or for their lung disease, right? So they're choosing between can I afford to pay for my rent, my food, and either my preventative medication or my rescue medication, right? That is current status right now. That is this week in the emergency department that I have seen personally. Now, let alone when these cuts come into effect, when we no longer have this match, where is that patient going to go, right? They're going to come to the emergency department, but they're going to come to the emergency department when they're very, very sick, and when we could have prevented this all, from the very onset. So there will be lives lost, unfortunately, if these cuts continue to push through. And our elected officials need to know this. They need to see this, and they need to look the electorate in the eye and tell them exactly what they're doing and why they're doing this.
And Dr. Ford, you brought up that in Wisconsin, your Medicaid program is called Badger Care. And I know many states have, come up with their own names for the Medicaid expansion that was authorized under Obamacare. I've seen some observations that a lot of folks may not know that they're actually on, federal Medicaid because they associate it with the name in their state. I'm wondering if there's a concern that there will be a rude awakening, when these cuts finally kick in, because not all of them are coming at once, and people suddenly realize that they're not covered anymore, and what the fallout will be for that.
Yeah, that's the reality of what we do. And in each of these interviews that we do, when we're trying to get this message out, we're trying to let, people know how they will be affected. I always will say, if you're listening to this, someone who is on Badger Care, Medicaid, Tin Care, whatever. Someone who is on this, right? These are our neighbors. These are our working class folks, right? Your mail person that's bringing your mail to you, the person at the grocery store, your grandparents, your children. These are all folks who will be affected by these cuts. And even if you're not on it, if you're on private payer insurance, you're going to be affected too, right? These costs are going to trickle down, right? And so this is a part of that branding of naming it state by state. However, just know that Medicaid cuts will affect all of us. It will affect all of our communities, and we need to push against this in order to protect our communities and protect those who need the help the most.
And just to piggyback on that, I'm reminded of during the first Trump administration when there was clear polling data that people supported the ACA but didn't support Obamacare.
Right.
They
Right.
didn't know that it was the same thing. And it's just really sad because contrary to what some of these elected officials think or try to behave like, many of the people that are going to be impacted are their supporters, the Republicans.
Mhm.
And I would venture to say that almost half of my patients voted for Trump.
Mhm.
And so the idea that only a certain demographic is going to be impacted by this is just flat wrong. And it's going to impact all of us. And the cost of healthcare is increasing much faster than inflation or wages. And my patients can't keep up. They might get a $1 an hour raise, but the cost of their healthcare went up by 20%. And so it's just really, really sad that they can't even talk about alternatives. We've been hearing for years, like, let's cut Obamacare, this bad, and it's not a perfect system. It's if I designed a system, it would not be the way that the current system is, but it's something. It gives my patients access, and if they don't like it, they should tell us what they would rather do. What would they rather have us do to provide healthcare to all of our people? And then let's have a friendly debate about that. But that's not where we're going. We're just cutting healthcare away and not talking about anything to do to help the people afterwards.
And healthcare premiums are set to go up for folks who are not on Medicaid. They're not on the ACA exchange. People who get their health insurance through their employer. Dr. Ford, do you know about what the average, increases that people are going to be facing next year?
Yeah, I think it was Senator Warnock that recently had a post up on his social media where he talked about a family of four, right? And in that example, he had a premium up of about $500 a month for a family of four to be covered for just medical, not dental, but just medical, right? And so what we saw, projected for that family after open enrollment comes around November 1st is that premium goes up to about $2,000, right? And
That's
so right. That's an insane number, especially for
and
people
nobody is budgeting for that.
no one's budgeting for that. And that's the reality that our elected officials need to know is that these are working class people. These are people who do work, right? These are people who are trying to make ends meet, and they don't have that additional $1,500 sitting around anywhere. People are living check to check. That is the reality for the majority of our American population. And so those effects are going to be felt. And again, these folks are going to be in a position where they got to choose between am I going to take this medication, or am I going to have a roof over my head? Am I going to be able to feed my children?
And as a result, if you're facing your premiums going from $500 to $2,000, a lot of people will make the choice that they can't afford to have health insurance anymore, and that will have a significant effect. Maybe they'll start visiting you, Dr. Bhatti, in your clinic, or they'll just go without care. Correct?
Yeah, I mean, we take everybody. We pride ourselves on that. But the tools in the toolkit that we have at our disposal to help somebody who has insurance, whatever they have, are still way more than the tools in the toolkit that we have to help somebody who doesn't have insurance at all. And so, even if they seek care from free clinic, they're not going to get nearly the caliber of care, or they're not going to have access to the medications or diagnostic testing, procedures, surgeries. Like they're just not going to have it without health insurance.
And Dr. Bhatti, I know that you are the Michigan lead for the Committee to Protect Healthcare. Dr. Ford, you're also a member. Can you talk with us just about what your organization does and how long you've been around and what kind of impact you've been able to have? I'll start with you, Dr. Bhatti.
Sure. So we're a national healthcare advocacy organization that exists in not every state, but almost every state now. And what we do is we advocate for people to have access to healthcare. And we've got a C3 component where we educate the public and educate elected officials about healthcare in general and the impact of policy decisions on patients across the country. And then we've got a C4 arm as well that helps support candidates who share our values. And those values are not supposed to be inherently partisan. Those values are simply, let's try to do everything we can to promote the health and well-being of our patients, to try to, do everything we can to reduce their risk of having bad outcomes and try to prolong their life to the best of our ability. And that's what we stand for.
Yeah. And we've been active around this issue, specifically around the shutdown. We've been distributing open letters to our network of over 40,000 physicians across the country to speak out against this, just to try to give physicians some way to fight back in this fight, right? We've been co-sponsoring a rally with Fair Share America and other partners throughout the country. Healthcare Over Billionaires is the name of that rally. And, we organize in congressional districts across the country just to push this pro-healthcare, pro-patient agenda, because that is exactly what we need at this point in time. That is what we as physicians have sworn an oath to do no harm. And, at this point in time, the time is calling for us to do this.
And Dr. Bhatti, I know back when I used to be the editor at the Michigan Advance, I've talked with you and my staff did quite a bit during the pandemic, especially around all of the healthcare misinformation, especially around vaccines, even masking that was circulating. And so I wanted to ask, now we have Robert F. Kennedy Jr., who is the head of the Department of Health and Human Services in the Trump administration. His big tagline is to make America healthy again. But we've seen that he has made, vast changes to vaccine policies. If you've gone to get your COVID shot, as I just did over the weekend, far more paperwork than there ever was, far more hoops to jump through this time around. He's made a lot of changes to various boards that oversee vaccinations, not just the COVID vaccine, but vaccines in general. And there's been a huge cutback in scientific research for the Trump administration as well. Dr. Bhatti, where does this leave us as a country with these huge changes in terms of scientific research and vaccine policy?
It leads us to an unprecedented time where every issue in our country is hyper-partisan, including, unfortunately, healthcare. Because we're not just talking about vaccines, we're talking about the dismantling of the United States Preventive Services Task Force. And that's a body that studies all the evidence, and they make recommendations that doctors follow every day. At what age should we start doing mammograms? At what age should we start doing colon cancer screening? What medication should we give to a pregnant woman when she's having preeclampsia or to try to prevent preeclampsia? Should we screen people for lung cancer who are smokers? And when should we do that? And how many packs of cigarettes do they need to smoke in order to be eligible? All of those guidelines, cancer screening and everything else, cardiovascular risk protection, all of those guidelines are evidence-based. Everything we do in science, in medicine, is supposed to be evidence-based. And what you've got now is you've got a director and Secretary Kennedy, who is doing things that are not evidence-based. They're based on other agendas. They're based on health beliefs that he has that the scientific community doesn't share. And many, many people, millions of people, are going to be harmed by this hyper-partisan focus on just the narrow vision of what Secretary Kennedy has in store for America.
And Dr. Ford, how do you see that fitting in along with all of these, huge increases in healthcare premiums and people who are being kicked off of the Affordable Care Act and Medicaid? Where are we at as a country in terms of healthcare right now?
So, just to touch on what Dr. Body said, it's a sad day when we can't trust the information that is being put out by the FDA, by the HHS Secretary, and by the CDC at this point in time, right? When we have to question it as governing bodies in medicine. And then you couple that with the decreased access to care, and then, mix in the already pervasive social determinants of health, and you have a recipe for disaster, right? And so, again, that's where we all need to step up as healthcare providers. We need to speak out as loudly, if not louder, than some of these folks who are using disinformation and misinformation at the highest levels, unfortunately, at the, like the HHS Secretary is doing at this point. And we need to counter that with evidence-based medicine, with what we have trained for in order to improve the health of our populations and continue to help our elected officials see that, right? Know that what it is like to walk in our shoes as being on the front line as primary healthcare providers, what the common pitfalls are, and what the actual realities are for our patients, and if they have that availability for their medications, for procedures, because that is going to be key in order to turn the tide in this situation.
And I'm sure when both of you, decided to go into medicine, obviously you wanted to help people, and that was your focus. You probably didn't envision yourself as having to be public policy advocates, but it's wonderful to get your perspective because you are the experts. Um, Dr. Ford, where should people go to get the best information in terms of what they should be doing for their health and what they should be doing if they need to make sure that they have health care next year? What are some good resources for people?
Yeah, so like we said before, the CDC and FDA, we have all, I think pretty much there's a quorum right now in all the governing bodies of medicine. So the American Colleges of Emergency Medicine, the American Association of Pediatrics, all have had policy statements that have come out against or run counter to those of the CDC. So I would more so listen to your physicians, right? Your physician is there for you. They are trying to do the best for you. And I would also reach out to those same governing bodies. You can go to the AAP website if you have a problem or have an issue or questions about your child's vaccination schedule. If it's something seems not right, it may not be if you're hearing that information. I would also recommend to my patients, as I do, face to face, be wary of the information that you're getting, especially that information online and especially that information on social media. So you want to make sure that you bring that to your doctor, bring that to sources that you can trust, and help us guide you to make that decision for yourself and for your families.
And Dr. Body, I'd like to give you the last word here.
Sure. I mean, doctors are like everyone else. There's Republican doctors and there's Democratic doctors, but every doctor not only takes an oath to do no harm, but we agree on a set of facts. We agree on what works. The evidence leads us to a certain direction, and we adjust our care accordingly. Unfortunately, there used to be a time when politicians would have a set of facts that they agreed on, and then they would give their perspectives on what to do about it. And now we live in a world where we don't even agree on the facts anymore, where you've got an alternate reality, an alternate set of facts in your individual silo. And really, like Dr. Ford said, the best way to try to get people out of those information bubbles is one-on-one, is because I have a lot of patients of mine, like I said, who voted for Trump, but they trust me and they trust the recommendations that I give them, and they know that I'm going to do everything I can to help them. And when I say that, a particular treatment is safe, they're going to listen, even if President Trump says otherwise. So that's the best way that we can really combat this, is by, rising above the politics of this, understanding that, yes, a lot of us tend to swing left, but many doctors swing right. My primary care doctor is a Republican, but I trust him. And we agree on so many things as far as what's best for our patients, what the science says, because that's not in doubt. And so that one-on-one relationship with physicians is really the best way to combat the misinformation.
Doctors, thank you so much for taking the time to be with us today. And thank you to all of you for joining us.
Thank you, Susan.
Thank you.